Let's get back to it because really anything anybody can talk about right now is this terrible air quality in New York City.
Yeah, intense wildfires in Canada are causing that haze and smoky conditions here in the city, as well as other parts of the country.
Yeah, air quality alerts now in effect for most of New Jersey and parts of New York as well.
Yeah, so joining us now to talk about it is Dr. Freddie Davis, the Long Island Jewish Emergency Department Associate Chair. Welcome to the show.
Well, thank you.
All right, so doctor, first of all, a lot of people have been asking, is it safe to be outside and for how long?
It's a great question. Obviously, you could see the difference it is being outside today as compared to a few days ago. I think one of the things we've noticed is that not only can you see it, but you can smell it. So is it safe? It's probably not its safest to be outside right now, and reducing your exposure is probably in your best interest.
Yeah, absolutely. So let me ask you something. Are some people more at risk than other people if they're going outside today?
Again, those that usually have respiratory illnesses, those that have asthma, bronchitis, chronic obstructive pulmonary disease, these are people that we worry are more at risk, especially breathing in these thicker particles and getting them more concerned of having a respiratory exacerbation.
Okay.
So, Dr. Davis, you mentioned that just limiting your time outdoors would be the best thing to do at this point, but does wearing a mask help?
I think that, we've seen that wearing a mask can reduce the number of particles. It filters out. It works as a natural filter of what we're breathing in. And especially since we're concerned of all the matter and particulates that are in the air, reducing that's actually getting to our lungs and getting into our system can be helpful. So I think a mask can be helpful in these cases.
Yeah, so a good thing, because I'm seeing a lot of people out there with masks, so I agree with that for sure. What are some other ways, though, people can stay safe? Because nevertheless, people have to get outside. They have to get to the subway. They've got to walk their dog. They've got to get across town. People have no choice but to get outside. How can they stay safe?
So again, the amount of time that you can spend outside, if you can reduce that, that's probably your best and safest way. If you have to go outside, wearing a mask, limiting your exposure to outside. When you're back inside, trying to reduce the amount of oxygen or air that's coming through from the outside by closing windows, having a humidifier, an air purifier in the house in a specific room that can help filter out some of those particular matter will be very helpful.
Okay, so doctor, I know a lot of people have been saying today that they're feeling an extra pressure in their throat, scratchiness. So how can you tell if the air quality is actually impacting your health?
So I think those are some key examples when you start noticing that it is a little bit more difficult to breathe, that you notice that you feel like there's that scratchy sensation. It's probably going on because there is different air that we're breathing. The quality is different. Those are signs that perhaps it's time to go indoors. Try to get to a place that has an air purifier and really reduce the amount of exposure that you're having to these outdoor elements at this time.
So let me ask you a question. Are there any long-term health effects to this wildfire smoke? Because I think that's a big concern when you're breathing it in and you're feeling that tickle in your throat and you're wondering what happens. What's the long-term effects?
That's a great question. A lot of the times when we start seeing things, like you think about the firefighters that get exposed to this long term, we see a lot of things that can occur. We see exposures to developing lung diseases, to developing cancers, and very long-term effects of this. While our short-term exposure shouldn't expect to have that, we don't want to possibly increase our chances. So again, reducing our exposure outside and reducing the amount of exposure to these elements will really be key in preventing all those.
You touch really quickly a little bit on the elements. We know that we're expecting some rain showers in probably the next day or two. Could that be a potential hazard? We're hoping that it'll clear out the smoke, but with the rain and the particles in the rain.
Yeah, and that is great. It will clear out some of the smoke, but I think it also brings up particles closer to where we're breathing them in. So while it might actually help in clearing out the general area around us, it could also lead to an increased exposure at those times. So again, all those times I would probably also recommend staying indoors and letting nature do its job and cleaning it and naturally filtering all these exposures.
All right, Dr. Davis, thanks for joining us. A lot of information today, especially if people have to get out and about. We appreciate it.